Good afternoon, everyone. Thank you so much for joining us. Today, we are here to discuss our training, which is entitled Ask, Advise, Refer, and Prescribe, Strategies for Talking to Cancer Patients About Tobacco Use. My name is Kirsten Ingraham. I would like to extend a warm welcome to you all for joining us. I serve as the Assistant Director here at the Duke Cancer Institute's Community Outreach Engagement and Equity team. I will be the moderator for today. And as you have different questions that you would like to ask throughout the presentation, please feel free to place the questions in the chat. And we have a section at the end of the segment in which we will have some back and forth dialogue regarding the questions. So a quick overview of today's training. First, we were going to have an overview on the North Carolina Advisory Council for Cancer Care and Coordination that will be provided by Sarah Arthur, who is with the Cancer Prevention and Control Branch at the North Carolina Department of Health and Human Services. That will be followed by Dr. Ronny Bell, who is with the University of North Carolina at Chapel Hill in the Division of Pharmaceutical Outcomes and Policy in the Eshelman School of Pharmacy. Next up, we will have an overview in regards to the North Carolina Oncology Navigator Association overview. We will provide some information about the organization and ways to engage with the group. Then we're going to go into our training, and the training will be led by Mrs. Megan Keith. She is going to be talking about tobacco cessation training, the Ask, Advise, Refer model, strategies for talking to cancer patients about tobacco use. Megan is here with us here at the Duke Smoking Cessation Program. And then next we're going to have Ms. Joyce Swetlick from the North Carolina Department of Health and Human Services discuss QuitlineNC and local resources. From there, we will have our question and answer discussion. Thank you again for registering for the event. What we will do is we will make sure that those that have indicated that they would be interested in a CE credit, we will be able to follow up with subsequent emails so that you're able to complete the needed evaluations to receive the CE credit, as well as make sure those that would like to have a certificate of attendance receive that as well. You'll receive that information via email. Also, as you can see, we are recording the event, so we will be making sure that as we record the event, that we share the recording with everyone in attendance and those that registered. So without further ado, we're going to go on to Sarah Arthur.
Yes, good afternoon, everyone. Thank you for joining us today. As Kirsten mentioned, I'm Sarah Arthur. I'm the Comprehensive Cancer Control Program Manager with the Division of Public Health. Next slide, please. So I'll be sharing with you guys about the North Carolina Advisory Committee on Cancer Coordination and Control. Now that's a long title, so for the purpose of this presentation, I'll be referring to it as the Advisory Committee. You may also see it in written format as the ACCCC. So it's a lot of C's, but that's kind of how I'll be referring to it for the rest of this presentation. Next slide, please. So the North Carolina Advisory Committee on Cancer Coordination and Control is a legislatively mandated committee. It works to reduce the incidence of cancer. It works to reduce the cancer incidence and mortality for all North Carolinians. Our committee was founded in 1993 when a group of cervical cancer from the Cervical Cancer Task Force went to the General Assembly and kind of suggested the need for a statewide coordinated effort for cancer control, and that's kind of how we were founded. We just recently in November celebrated our 30th anniversary of the Advisory Committee. We are one of the longest standing cancer coalitions across the nation. Since our foundation, the CDC, the Centers for Disease Control and Prevention, has funded all 50 states to develop their own cancer coalition for their states. And so we are proud to be one of the leaders and the founders of the Cancer Coalition across the nation. The Advisory Committee works across the cancer continuum with four subcommittees. We have the Prevention Subcommittee, which you'll be hearing from Dr. Bell about the wonderful work they do. We also have the Early Detection and Care and Treatment in our Legislative Subcommittee. Next slide, please. So the advisory committee has 34 appointed members. The members are appointed by the NC governor, our NC House of Representatives, and the NC Senate. In addition to our appointed members, we have over 100 partners that are actively involved and support the advisory committee and our subcommittees. Next slide, please. So part of our general statute requirement for the advisory committee is to develop and implement a statewide cancer plan. Our cancer plan is created for a 5-year period of time. So as you can see, our current cancer plan that we're using is the North Carolina Comprehensive Action Plan from 2020 to 2025. You may also hear me refer to it as the cancer plan for moving forward. The cancer plan is a framework for action to reduce the burden of cancer, and it covers those entire cancer continuum from prevention, early detection to care and treatment. And it identifies cancer challenges and issues that affect North Carolina, and also offers goals and strategic actions supported by evidence-based interventions for current cancer information. Next slide, please. So our cancer plan is broken into 3 components. So you have the action priorities. This section has information on cancer risk factors, healthy behaviors, policies, environmental changes that can reduce all North Carolinians' risks. Then we have our priority cancer section. This emphasizes the 6 priority cancers which were selected because they can be prevented or screened. Our 6 priority cancers are lung, female breast, colorectal, prostate, cervical, melanoma, and non-melanoma skin cancer. And then lastly, what is an action without a call to act? What's a plan without a call to action? So throughout our plan, we have strategic actions for what everybody can do on their part to help reduce the burden of cancer, as you can see here. Next slide, please. Oh, one more slide. And then we try to ingrain everything we do with the advisory committee and within our cancer plan to have a health equity lens. All of our chairs for the advisory committee, along with our subcommittee co-chairs, are tasked with having using all their initiatives and having that health equity lens as they move forward. Next slide, please. Yep, that's all I have. And I'll pass it off to Dr. Ronny Bell.
Thank you, Sarah, and thank you everyone for being here, and thank you, Kirsten, for moderating this very important workshop today. So I am at UNC. I am the Fred Eshelman Distinguished Professor and Chair of the Division of Pharmaceutical Outcomes and Policy at the Eshelman School of Pharmacy at UNC Chapel Hill. I'm also a member of the North Carolina A4C and co-chair the prevention subcommittee with Kirsten, and also co-lead the Southeastern American Indian Cancer Health Equity Partnership, or SICEP, which is a partnership across the 3 NCI designated comprehensive cancer centers in North Carolina to specifically focus on cancer disparities in our American Indian populations in North Carolina. Next slide. So I have a few minutes here to talk with you about the work of the Prevention Subcommittee. And as Sarah mentioned, we are one of the subcommittees of the North Carolina A4C. And we have the privilege of working in the cancer continuum using evidence-based strategies to help in the primary prevention space to help people reduce their risk of developing cancer. Next slide. So our mission really is to focus on these efforts to address cancer risk factors in the populations in our state, and to provide educational initiatives like this, and to help promote systems change using or identifying evidence-based strategies to reduce those risks. And we've worked in the space in the cancer plan around goal 1, which is to reduce cancer risk by supporting healthy behavior change among the citizens in North Carolina. And the document on the right is our 1-page strategic plan for 2023 and 2024. Next slide. So this is our purpose statement here is to provide guidance to impact healthy behaviors through promotion and education policies and environmental changes that can reduce the risk of cancer in North Carolina citizens. And our vision is to provide education and promote policy, system change, and evidence-based interventions to reduce cancer risk factors. And we have 3 focus areas. So tobacco is one of our areas. So we get to co-host events like this, and we get to work with Joyce Swetlick and the Cancer Prevention and Control Branch to reduce the burden associated with harmful tobacco use among citizens in North Carolina. We also work in environmental exposure, so particularly with radon and with sun exposure, sorry. So promoting sunscreen use. And then with behavioral risk factors, so looking at healthy eating, physical activity, and those factors that we know can reduce the risk of cancer, and working in these 3 areas to address health equity. So knowing that certain racial and ethnic populations, sexual minority populations, and rural populations have increased risk of cancers. And so working to ensure that in these 3 priority areas that we are promoting health equity across these priority populations. Next slide. And then these are just 3 of the products that are available through our partnerships with organizations across the state. So our lung cancer toolkit, which is a great resource for healthcare providers to talk with their patients about lung cancer screening and reducing the risk of lung cancer. And then the Live Healthy to Be There action plan, which is a partnership with the Eat Smart Move More program and North Carolina State to promote healthy lifestyles through healthy eating and physical activity. And then the radon fact sheets, working with the North Carolina Radon program to promote screening for radon in homes and in businesses to mitigate the risks associated with radon exposure. Next slide. So now I will turn it over to Jean Sellers.
Thank you, Dr.
And
Hello?
Kirsten, Jean Sellers just messaged. She is unfortunately feeling under the weather, so she's not able to speak. She is on the call with us, but she's not able to speak. So would you like for me to cover, or would you like to? I know you mentioned you had something prepared.
Definitely. We'll definitely share that. And so sorry to hear that Jean is under the weather, but definitely want to share all the amazing work that she is spearheading with the North Carolina Oncology Navigator Association. The next slide. All right. Sarah, would you like to lead this piece for Jean?
Sure, absolutely. So the North Carolina Oncology Navigator Association is also short for, you might also hear it referred to as ANCONA. As you guys can't tell, we do love our acronyms. So the mission of the North Carolina Oncology Navigator Association is to advance the role of patient navigation by providing a network for collaboration amongst navigators and to promote the development of best practices for improved access and outcomes of cancer care. That's kind of rude. ANCONA has committed to work collaboratively with all cancer programs and organizations across the state to ensure every patient living in North Carolina has access to appropriate cancer care. The landscape is changing, and it is imperative that hospitals and communities work together to reach services our patients most need. I encourage you all to kind of check out their website. ANCONA also has a lot of great resources for everybody. Every year they host a conference, and it's very fruitful and has lots of great resources. So please take a moment to check out their website whenever you get a chance. And so this kind of goes over a quick overview of the National Cancer Institute designated comprehensive cancer centers across North Carolina. We are very fortunate enough to have 3 designated National Cancer Institutes, which doesn't happen often. So we're pretty fortunate for that. So we have Wake Forest Baptist Comprehensive Cancer Center, the UNC Lineberger Comprehensive Cancer Center, and Duke Cancer Institute.
Thank you so much for sharing that with us, Sarah. Next, without further ado, I am honored to be able to introduce Megan Keith. She is going to provide this section of the training. Megan is a licensed clinical social worker and tobacco treatment specialist with DCI's QuitlineNC program. She has a bachelor's degree in social work from NC State University and a master's degree in social work from East Carolina University. Megan has been with QuitlineNC for over 5 years and worked in both inpatient and outpatient behavioral health settings before coming to Duke. So without further ado, I pass the virtual mic to Mrs. Megan Keith.
Thank you so much, Kirsten. And I'm gonna share my screen here. Well, actually, I don't think I have the learning objectives on mine. So let me go over the learning objectives first, and then I'll share from mine so I can control my slides. Our objectives are to describe tobacco use rates in North Carolina and with the cancer population, identify causal relationship between continued tobacco use and cancer risk recurrence and worsened cancer treatment outcomes, describe effective methods of tobacco use treatment, and to summarize, ask, advise, refer model to engage patients in tobacco use treatment, including using a validated question to assess tobacco use. All right, so I'm going to go ahead and share here. All right. There we go. So just a few statistics to get us started. 17.8% of the population in the US smokes, and that number is a little bit higher here in North Carolina at a little over 20%. 67% of current smokers will die from illnesses caused by smoking. So that's why this is such an important issue. The average smoker has over 7 unsuccessful attempts to quit before they're able to quit for good. So this is an important issue that we need to bring up to our patients, give them all the information about the most effective treatments for smoking. There are over 12 different kinds of cancer that have firmly established links to tobacco use. People are usually aware of, lung cancer and its association with tobacco use, but people are usually less aware of the connection with uterine cancer, cervical cancer, bladder cancer, leukemia, these other cancers, and we're finding new links all the time. So there may be other cancers that are linked to tobacco use that we just haven't found yet. But the important thing to note is that risk is reduced after you quit. So, once people have the information that they need, they can get the treatment that they need to quit smoking, and that's going to help their health moving forward. So that brings us to, why should a patient quit smoking after a cancer diagnosis? And I hear this a lot from patients. I've already been diagnosed. There's a lot going on. Why should I quit now? Well, reduced risk of recurrence at the same location is a big one. Reduced risk of a second primary cancer, improved surgical outcomes, improved chemotherapy outcomes, so reduced risk of side effects from chemotherapy, and then reduced risk of complications from radiation. So those are some big reasons to quit. In addition, what we know is that over 12% of cancer survivors over age 18 currently smoke, and that's based on data from 2020. So, we've got patients who continue to smoke after they've been diagnosed, as well as survivors of cancer who continue to smoke. So these are populations that we really need to do our best to reach. So why do people continue to smoke? What are these challenges that they're dealing with? Most of the time, people who smoke suffer from high levels of stress, anxiety, and depression. And these are challenges that are highly predictive of smoking relapse. So when people quit, if they are dealing with high levels of stress, anxiety, and depression, they're very likely to relapse. And a lot of people want to quit smoking, but they're faced with the obstacle of cost. So we want people to know that there are lower cost alternatives. And, experiencing cancer is a very stressful time for patients. They're being expected to give up one of their primary coping strategies at a time when they're least equipped to do so. So, super important that we offer the most effective treatments to our patients during this time. So, what we've come up with as the best way to address tobacco use with patients, and by best, I mean, backed by research as being effective, is the Ask, Advise, Refer model. So, this refers to asking, so identifying tobacco use at every appointment. So, every time the patient comes in, they should be asked about their tobacco use. If they are identified as using tobacco, we should advise the patients in a clear, strong, and personalized manner that they should quit. And then refer is to make a referral to a resource that offers comprehensive tobacco use treatment. So let's start with ask. What is the best way to ask about tobacco use? We want the question to be open-ended, non-judgmental. I've had the experience of going into a doctor's appointment where the nurse simply says, "You don't smoke, right?" If I don't smoke, but if I did, it would be really easy to say, "Nope, don't smoke" to that question, particularly if I was a person who only smoked occasionally. Very easy to say no. So, better to ask, can you tell me about your tobacco use? That gives the patient a lot of opportunity to really share what's going on with their tobacco use, especially if they're, like I said, an intermittent user. They'll be able to disclose that at that time. And if they're listed as a former smoker, great to ask, when was the last time you used tobacco? Because it's really easy for that information to be missed for patients who are listed as a former smoker. So we want to make sure we get the updated, correct information at every visit. All right. And the other thing to think about is when we're asking this question, patients may be using alternative forms of tobacco. They may be vaping. They may be using, chewing tobacco, dip, snuff, something like that. So we want to make sure we are capturing all of that information. So during the time that we are asking about tobacco use, this is a really nice opportunity to update the patient's tobacco use history. And this snapshot I have right here is from Epic configuration that Duke uses. All electronic medical records are different, but there should be a section with this information in the health record. And it's really helpful to make sure that's updated at every visit as you're checking the patient in. So the next step in the process is to advise. So you want to give the patient personalized, specific advice, something that it takes into account their particular situation. So, you can say things like, one of the best things you can do as part of your cancer treatment is to stop using tobacco. Quitting smoking can help you recover more quickly from your upcoming surgery. It can be hard to make a change. I will connect you with a dedicated team that can help. Or I will refer you to a program that offers the most effective treatments available, behavioral counseling and medication together. In addition, when you are advising the patient, using motivational interviewing techniques can be really helpful. So motivational interviewing is utilized extensively in substance use treatment settings, and that definitely applies to tobacco use. Motivational interviewing is a collaborative, person-centered form of guiding to elicit and strengthen motivation to change. So these techniques really help address ambivalence, create discrepancy, as well as identify readiness, willingness, and ability to change. So motivational interviewing techniques are really a style of talking to patients that helps them really think about their use in a different way and come to their own conclusions about what they want to do next. So the guiding principles of motivational interviewing include resisting the writing reflex. So this is the tendency to advise patients on the correct action for good health. In motivational interviewing, it's really about asking questions and getting information from the patient, asking them if you can provide information to them about, whatever it is you're talking about their tobacco use, about treatment options. Understanding the patient's motivations. So the patient's own reasons for change are more impactful than the provider's reasons for the patient to change. Listening with empathy is also extremely important. Patients want to know that they're being heard and that their input matters, that a provider isn't just pushing their own agenda. So you want to spend equal amounts of time listening and talking. And also important to empower the patient. So patients are more likely to follow through on a referral if they feel like they were part of the decision to make that referral and that they have a role in their treatment decisions. So as we are, moving forward with our with motivational interviewing, if you're interested in this technique, there are lots of great trainings about it. So some treatment options. When you get to the next step, which is refer, there are really good tobacco treatment programs here in North Carolina. We have some at each of the comprehensive cancer centers. And then QuitlineNC is a really great free resource for patients. And Joyce is going to talk about Quitline a little bit later in the presentation. There are also quit smoking applications that patients can download on their phones, texting programs. And Quit at Duke offers, we are one of the NCI cancer centers, and we offer evidence-based intensive tobacco cessation, referrals to low-cost alternatives, and we have specialized services for patients with cancer, and we offer those in person or via telehealth. We offer comprehensive evaluation, evidence-based medications, targeted behavioral treatment, and long-term phone-based follow-up. Our evaluations are comprehensive, so we are evaluating the patient's level of dependence, their ability to cope, any underlying mental health or substance use, concerns about weight gain, their level of support, and any financial challenges. And once we have that comprehensive evaluation, we then move on to medication options, working with patients closely on combination pharmacotherapy. We will often combine multiple types of medication together to find the best fit for the patient and the most effective. And we also offer pre-quit treatment, starting the medications prior to the patient's quit attempt, as well as adaptive pharmacotherapy. And what I mean by adaptive is we are meeting with the patients frequently and adjusting the treatment plan based on what's working or not working for that patient. And extended treatment is also very common in our program. So keeping the patients on medications longer to help with relapse prevention. Our program also offers intensive behavioral treatment options. We have an 8-week group therapy intervention that meets weekly for 2 hours. Really well received by patients and very effective. We offer individual therapy appointments. I do those with patients in person or via telehealth. And we also have web-based treatments available. And to make a referral to Quit at Duke, patients can self-refer to the program or can be referred by a Duke provider if they're a Duke patient. And they can call our main number, 919-613-QUIT or 919-613-7848 to speak with one of our outreach specialists. Our outreach specialists are specially trained as tobacco treatment specialists. They've gone through the TTS training and are able to answer questions and reassure patients very effectively when they're calling in. So my contact information is here. Like I said, our main number is 919-613-QUIT, and there's my email address. I'm very happy to answer any questions for people if you want to contact me directly. And we are going to have a time at the end of the presentation to answer questions and go over everything that we've talked about today. So thank you very much.
Outstanding. Thank you so much, Megan, for that comprehensive overview. I'm looking forward to our Q&A session. I know it's going to be filled with a lot of great questions. Next, without further ado, we are going to pass the virtual mic over to Ms. Joyce Swetlick.
Hi, everyone. I'm going to share my screen real fast. If I could. Okay, let me go back. Thank you. I'm going to take off my my video so that I make sure I get through the presentation without the internet throwing me off. Okay. So good afternoon, everyone. My name is Joyce Swetlick. I'm the Director of Tobacco Cessation in the Tobacco Prevention and Control Branch of the Division of Public Health. This afternoon, I'm going to talk about several population-based services we fund and provide for North Carolinians. Okay, let's see if I can get this to move. Yes. So we provide these services to help providers and residents an alternative evidence-based service for referrals and use. Sometimes providers do not have a referral site or a resource to send a person who used tobacco for intensive services that they can go to in person and in groups, like was mentioned by Megan. So this is when a population-based service is very useful, like QuitlineNC, that can be very helpful. Because it's population-based, the services provided may have a lower quit rate than the face-to-face program, like Megan was talking about, but it does have a greater impact. You know, if an individual program have a high quit rate where half of the people who receives that service are able to quit, they're only able to see a certain number of people because it's very resource intensive. With the quit line, we see around 10,000 people or more, with a third of the people who use the service quit. So moving the needle may mean there may be a natural trade-off where we implement a program with a little lower efficacy in order to reach more people, having a greater population-based impact. QuitlineNC is an evidence-based integrated telephone and web tobacco treatment service where individuals can work with a coach by phone, texting, or web, or a combination of the three. Coaches are available 24 hours a day and are highly trained and professional treatment specialists. Any adult who contact QuitlineNC will also be sent combination nicotine patches with plus gum or lozenge mailed directly to their home. And it's available free to all North Carolinian residents. It's accessible 24 hours a day, 7 days a week. Some coaches are bilingual and can speak to the person in English or Spanish. Or there's a translation service for many other languages, up to, I think it's about 277 languages. So to ensure that everyone who contacts QuitlineNC have the same chance of quitting, services have been modified for people who identify as African or Black Americans or American Indians, people who struggle with mental health conditions, teenagers, and pregnant women. Individuals can self-enroll in QuitlineNC in one of three ways. They can either call 1-800-QUIT-NOW, which is 1-800-784-8669, or go to www.QuitlineNC.com or text READY to 34191, which will send them to a link to a web enrollment. Spanish speakers can call 1-800-DEJALO, which is 1-855-335-3569, or type LISTO, LISTO, to 34191. A high-level participant experience includes 5 sessions with a Quit coach. 3 sessions are personal contacts through either call, text, or chat, as I mentioned before, and 2 sessions are group video sessions. Each session is coach facilitated to discuss progress and challenges. The group sessions create an environment that provides social support and encourages participants to help each other. The individual coach sessions cover selecting a quit date, managing urges, using FDA-approved medications effectively, social support, and creating a tobacco-free environment. So this is a page to sign up for online enrollment. So as you can see here, this is our Quitline landing page, and they can either hit one of the links to get a link to enroll online. This is the landing page for the enrollment. And once someone enrolls into the QuitlineNC through phone or online or web, they'll be directed to a platform dashboard just for them. And on this dashboard, you know, they're able to text a coach, they can manage their NRT, they get nudges to connect with a Quit coach. And there's a library, they can manage schedules, there's multimedia content cards, and they always have a clear call to action. So NRT is shipped now in 3 to 5 days versus the 7 to 10 days as before. So you can order them from the dashboard or a app or the status, and you can see the status of the NRT. So each of the dashboard has content cards that present the program in small segments. It has daily action cards to check in on the members and for the members to select a weekly goal. There are you know, bonus action cards, NRT cards, and then, you know, the cards to be able to chat or talk with a Quit coach. If someone is eligible for lung cancer screening, they can find the tab of resources, and they can see, you know, like what additional resources are available for them on this particular page. And if they're eligible for lung cancer screening, they will see this lung cancer screening at the top of the page. And once they press that, then they can go on and get information about lung cancer screening and how to enroll for lung cancer screening. Also, they can find their letter of enrollment. They can find other community resources like Duke or UNC so that they can enroll into face-to-face programs. And when they press these little carrots, they can see like when the program's available, who to call, how much it costs, and everything on it. And then there's a Rally Coach app that offers all that dashboard offers that I mentioned before. Members can order NRT, attend group sessions, interact with a coach via text, chat, or phone directly from the app, have full access to the dashboard articles, audios, videos that provide support every step of the way. They also have a text message. They can receive text messages and push notifications to engage with the app if they receive text messages. So while members cannot register into the program directly through the Rally Coach app, they will have immediate access after setting up their login credentials through their web enrollment or through the email sent to them after they connect with a coach. I mentioned that there were some tailored programs with the QuitLine where individuals will receive more than just the 5 sessions. And one is the pregnancy prevention program. It's not only for pregnant women, but those who plan to become pregnant in the next 3 months and those who have given birth within the past year. Trained Quit coaches will use the protocols for these women to help them, not only stay pregnant, not only stay quit during their pregnancy, but also after they have their baby. The behavioral health program extends the number of calls in combination NRT along with specially trained quit coaches and communication with the behavioral health care provider of the participant. And then for our Native American participants, we now offer a separate phone line, which will connect them to a Native American quit coach or a coach who has been specially trained to work with Native Americans. And they too have extended services along with extended combination NRT. So the teen experience is much like the dashboard experience of adult, but with TikTok-like videos, animations, chatting with a quit coach, and covering content like peer pressure, social impact, and cost of tobacco use. If someone calls with a limited English proficiency or whose primary language is Chinese, Korean, or Vietnamese, we will direct transfer them to an Asian smoker quit line where they can speak to an individual in their native language. They will receive 5 calls plus 2 weeks of NRT. And QuitLine also has a Facebook page to encourage tobacco users to quit and inform them of program opportunities. You can follow us by typing in @QuitlineNC to get our page and share our post. So to refer to QuitlineNC as a provider, we encourage you to become a QuitlineNC referral site. And the advantages of being a referral site is that you will be added to our web e-referral portal. We'll go ahead and sign you up for you so you don't have to go through that process. You'll receive outcome reports of your patients through a secured email for your patient's medical record, and the report will tell you if the patient was reached, enrolled in services, planned to quit, or engaged with our services. You'll also receive a monthly aggregate report of your site, patients that were referred to the QuitlineNC, updates to new services and promotions or changes, and technical assistance and training. And you can get this form on our QuitlineNC.com website. So to refer to the QuitLine through our web portal, you would go to this link at https and so forth. I'm not going to say it all, but you can get to that actually by going to our web page, and there's a link where you can click that and get to the web portal as well. You would choose your patient's state of residence and confirm the state when it's prompted. Once you're get on the portal, you will click search referring facility and enter your facility, as well as click the healthcare professional. And then finally, you would complete the referral form with your patient's information, indicate if and how you would like to receive an outcomes report for the referral. So you can receive an outcomes report by a fax referral, or you can get it through a secured email. So the progression for the referral for the provider is that once the Quitline receives a referral, they'll reach out to the member within 24 hours and make 7 attempts to reach that member, 3 of which will be an IVR attempt. And the member will either enroll or not enroll into the service, but if they do enroll, well, either way, there will be an outcome report that will be sent to the HIPAA-covered providers. And one thing to let your patient know when you refer them is that they will receive a call or a text from 1-800-QUIT-NOW that will show on most cell phone carrier callers' IDs. If it doesn't show 1-800-QUIT-NOW, it will show 1-800-784-8669. Okay. So we found that the percentage of participants using QuitlineNC were at or above the percentage of those who smoke within that populations that experience tobacco disparity. So we're hitting the populations that we're asking for or wanting to hit. But we do need to work a little bit harder on the LGBTQ plus population as well as the Hispanic, which is not listed here, but we're just a little bit lower than their population. Our quit rates run around 32.5%. And 2 factors that really affect the quit rate are the number of coaching calls that the participants complete, so it's dose response, and then also whether or not the person is living or working in a smoking environment. So those that are in a tobacco-free environment and live in a tobacco-free environment has a higher quit rate than those who don't. The return on investment for QuitlineNC is for every $3 to $4, sorry about that, for every dollar spent or invested, they will receive or save $3 to $4. So we now have a new program called Live Vape Free. It's a tobacco, cigarette, or dual-use cessation program for teens. They enroll in a multimedia experience that includes videos, quizzes, self-assessments, flip cards, audio, and podcasts. And they have access to a quick coach at any time by texting the word coach, and they can chat with the coach through text. As part of the Live Vape Free, there is an online course for concerned adults at www.livevapefreenc.com. This program will support adults when they want to have a proactive discussion with youth prior to the youth vaping, or they suspect the youth may be vaping but not sure what to do. This program has smart progress, self-assessments, and infinite learning options for programs. And it can be helpful for them to work with their teenager to quit. And it has easy mobile access from any device. So this is Quitting is another population-based program that we have for young adults that they between the ages of 18 to 24. So it is confidential and available 24/7. It's easy to enroll. The young adult will text vape-free NC to 88709. And they have an option to set a quit date, up to 12 weeks of daily text messages, interactive messages to get to know the users, and on-demand support for craving, stress, relapse, and more, and real-world tactics to approach quit vaping. There's also, if they type NC help, then they can also find out some North Carolina resources for them as well. And teens can go to quitthehitnow.com and join a cessation support group for young people who want to quit vaping called Quit the Hit. So this is a program for teens 13 to 17. And with this program, they can receive 5 weeks of online quit support. They'll join groups of young people of 10 to 15 with active moderation by the facilitator. And it's hosted on Instagram via group direct message. They will receive daily cessation education content, group challenges, access to peers for support and accountability, and have access to a cessation coach for questions and answers. So those are the programs that we have and support from the Tobacco Prevention and Control Branch. And here's my contact information. If you have any questions about anything that I talked about before, just email me or give me a call. Thank you.
Fantastic. Thank you so much, Joyce, for providing us with that robust overview of Quitline, not just QuitlineNC, but all of the various Quitlines that are available. If I can ask all of our presenters to have your screen visible if you are available. Now we are going to transition into our Q&A segment. We do have about 20 minutes to have some questions come in from the audience. One of the things I really wanted to preface to kind of set the stage as we go into the Q&A session is that the overall purpose for this virtual training really at the end of the day is for healthcare professionals, community health workers, etc., across this amazing field of health and public health and the oncology field regarding tobacco cessation in November 2023, in particular, because it's Lung Cancer Awareness Month, right? It's Lung Cancer Awareness Month. And so this is our way to celebrate Lung Cancer Awareness Month, highlight all the amazing work that's happening here across the wonderful state of North Carolina, hear about other information that is happening. I'm aware that we have many on the call that are from other states and possibly even other countries outside of the U.S. And so want to take this moment now to open up the discussion. Sarah or Brittany, would you like to facilitate the discussion piece as they come in the chat?
Sure. We have a question for Joyce. We had a patient recently just a comment more. Just a patient who recently raved about NC Quitline.
Oh, that's wonderful. Good to hear.
One of the questions that I was wondering as we look towards some of the other questions in the chat really is directed towards Dr. Bell and Joyce. And even you too, Megan, as well, because I feel like I know the answer, but I know some of those on the line may not. There was a part that came up in regards to lung cancer screening for those if they are using tobacco products. Can you share a little bit about how, for your respective programs, how if someone is identified as using tobacco products, what the referral process would look like for them to receive a lung cancer screening?
With the QuitLine, basically what that does is just screens people to see if they're eligible for screening. So with the answers that they provide with the surveys, if they are eligible for screening, then we will provide a resource that they go to where they can be educated about lung cancer screening. And from that, it's a national website. And from that website, it will direct them where they can go and how to talk to their doctor about getting screening.
Thank you.
And here at Duke, we have the Duke Smoking Cessation Program has a close relationship with the lung cancer screening program at Duke. So we refer back and forth very frequently, and our providers are screening our patients to see if they meet the criteria for the lung cancer screening when we have appointments with them. So that's, age 50, been smoking 20-pack year history of smoking. I think it's 50 to 80 is the criteria, but we are definitely checking that out for all of our patients and referring them as appropriate.
Thank you. And let's see. We have another question in the chat. Well, actually, we have a few. Wow, this is awesome. Can you tell me what department your tobacco cessation program is housed under?
Okay, so at Duke, we have the Duke Smoking Cessation Program, also known as Quit at Duke. And we have clinics in many different areas. So our primary focus is Duke Cancer Institute. But we do have clinics in some primary care locations, some different locations around Duke. So there are options for people who are not affiliated with the Cancer Center. We do have clinics that see those patients as well.
And at the Division of Health and Human, or Division of Public Health at Department of Health and Human Services, we have a tobacco prevention and control branch in the chronic disease and injury section. And we cover 4 goals from the CDC, which is not only help people to quit using tobacco, but also to prevent tobacco use and secondhand smoke, as well as reduce tobacco use in adults and young people, and reduce disparity and increase health equity.
Thank you for that. And I'd be remiss if I sit back and I look at our model in regards to our priority areas for our subcommittee, how the health equity aspect is really at the core across that continuum for both ways. So thank you for sharing those bases. Another question that we have in the chat is, these are coming quick like a teleprompter. What are some effective practices when encouraging youth to quit vaping using tobacco use? I think this question may be directed more so to Joyce.
Oh, okay.
Mm-hmm.
Well, some effective practices with encouraging youth to quit is to not to use tobacco treatment or cessation services as a punishment if they're caught with vaping or cigarettes, but to offer them the opportunities to use these services to help them. What we've tried to do is, meet the young people where they're at and provide them with programs and opportunities that they will use. We used to, have like a calls for young people, but no, they don't talk on telephones. So we modified it to where the programs are either chat or they have a program through texting. And it's a matter of, sometimes it's a matter of reaching them through social media. And then also, working with pediatricians and healthcare providers that work with youth so that they can ask the youth when they come in if they are a tobacco user and how they can help them as well. So it's reaching the young person where they're at, not being non-judgmental about offering them a service and letting them, just explore their opportunities.
That is awesome. Thank you for sharing that piece, Joyce. And
Kristen, did you get the question from James Nayamo? How are you working with those who have successfully quit to influence more quit enhanced smoking program outcomes?
Great question.
We have used a lot of the individuals that have quit, and we used to offer, and we're planning on offering again, where the individuals who quit through the quit line a happy line where, if they have quit, then they can tell us about their process of quitting, their experience of working with the quit line. And we use a lot of those and their testimonies on our websites and, on our brochures. And we, ask them if they'd be willing to speak to press when press contacts us. So we use them in many ways as advocates to our program and to each other.
And similar to what Joyce mentioned at Duke, we do the same. So we have patients who share their stories in Duke publications on social media. And with our group program, our mindfulness training for smokers program, we have previous attendees who have quit smoking who offer to come back and join the next set of group meetings to be a support and encourage the new folks who are coming through the group.
Excellent. Thank you for that. Another question that I have, and Sarah, I see you just came off of mute.
Oh, no, yeah, I was just gonna pose the next question. You're good.
No, go ahead, after you.
Sure. So to what extent are these interventions accommodative to smokers with various disabilities?
The materials that we provide through the quit line are, if someone has visual problems or sight problems, we put on our website where they can look at, the language in larger print. And then we try to, our brochures and things, we try to keep them from being very glossy and more flat and matted so that it's easier to read. We have, for those who are deaf and hard of hearing, we have a TTY, as well as we use visual relay program to help those individuals. And in regards to physical disabilities, we try to, promote the QuitLine by to a very generic audience. And on our brochures and things we try to make sure we have photos of those that have, physical disabilities to help them. And then some coaches are trained to work with individuals who have some cognitive disabilities to be more yeah, and we try to keep our materials at a 3 to 5 or 3rd to 5th grade level.
Yeah.
Great. Can you expand on current best practices for patients who may be dual users, for example, cigarettes and e-cigs or cigs and OTP?
I'll just speak to our program. We often run into patients who are dual users. The way that people use cigarettes and e-cigarettes tends to be different. So their sort of behavioral approach to use seems to be different. So the medication piece is going to be effective across the board for the nicotine addiction, but the behavioral counseling is going to be the key for dual users to address the ways in which they're using these products. So I always recommend behavioral counseling to all patients because it really is important. So that's what we really would push in those instances, is to work on addressing kind of the underlying behaviors and changing those behaviors, replacing their use, changing the way they're using the vape to be a little bit more like how they would use a cigarette, to make it a little easier to address. And that's how we handle that in our program.
And with the QuitLine, anyone who contacts the QuitLine will get combination therapy. So we try to keep away from providing just monotherapy for individuals to help them through, and then offer, a longer extension of a NRT. And again, as Megan says, they're coached. Their coach is part of it.
One thing I wanted to add really quickly before we jump into the next question, because I see 3 amazing questions that we still have yet to get to in the chat, is in regards to our 2023-2024 strategies for the prevention subcommittee. One of the things that we have listed for tobacco is involving patient navigators, community health ambassadors, community health workers to increase referrals to QuitlineNC using targeted health equity approaches. And so wanted to pose the question to all of our presenters on the screen. What are some ways that we can increase the use, as well as ways that we can increase utilization of the skill set of our community health workers, our patient navigators, our oncology navigators, and linking patients to needed services?
I'm happy to speak, and I think Joyce and I would both agree that we would love to get more people through the Duke UNC TTS training, tobacco treatment specialist training. That's a partnership between the state, Duke, and UNC that provides a comprehensive tobacco treatment specialist training course. And the more people that can get trained in these skills, the better equipped you'll feel to provide the information to patients, to give them advice, and to link them to other services. So that option is here, and the comprehensive training is a lengthy training. It's a 4-day virtual training, but we do also offer some short 1-day courses. So there are lots of options for getting additional training on tobacco treatment.
That's a wonderful answer, Megan. And we're raising the bar on providing treatment for people who use tobacco, and helping them to really be able to get standard of care services, which is counseling.
Oh, we're not able to hear you, Joyce. Nope. Nope, we cannot hear you at all, Joyce. We can see your mouth moving, but we're not able to hear any sound from your audio. Well, we work on Joyce's audio. I have another question, really for Megan and Dr. Val as we work on that piece. Megan, can you share a little bit about the work that you are doing in regards to tobacco cessation efforts in the American Indian community, as well as ways to be mindful as we're discussing tobacco within the community, and definitely looking at the two of you as we move to that question.
Sure, I can speak first. So I've actually been working with some folks in the community with our mindfulness training for smokers program. We've had several people come through and observe the program to see if what we're doing, how that can be translated to work most effectively for the American Indian populations in our state and widely. And I think understanding the differences in commercial tobacco use and sacred use is extremely important. So that's something that, if you're working with people who may have sacred use as part of their culture, really important to kind of understand that and the differences between commercial use and sacred use, so that you're not giving advice that is contrary to people's cultural practices and their beliefs.
Yeah, Megan, thank you. That is very important. And in that regard, we are working with the CISEP program and the state tobacco program and the North Carolina Commission on Indian Affairs. We are currently in the process of administering a tobacco use survey and using the survey instrument that the CDC developed specifically for American Indian populations that takes into consideration the cultural use of tobacco. So I think we're right at around 1,500 surveys that have been collected. Our goal is to collect 2,000 of those. And so there's lots of opportunities for us to engage with our tribal communities at powwows and other cultural events. So hopefully this survey will give us a lot of really important information about tobacco use in this population.
That is outstanding. Thank you both for sharing that. Joyce, are you able to reply to the question?
I'm sorry, I didn't hear the question.
Oh. Thank you. We were discussing in regards to available resources to the American Indian community regarding tobacco cessation resources.
Oh, okay. Well, we do have an American Indian QuitLine number that people who identify as a Native American can call. And when they call that number, they will receive information from a quit coach who is American Indian. And so, and a lot of times when we do go out and exhibit and provide promotion materials to American Indians, we have worked with a consultant who is also American Indian, and she helped us create all of our brochures. We went to each of the tribes in North Carolina and had them develop the brochure for the American Indian Quitline for their members in their nation. So that's one way that we have done that.
Awesome. Thank you. Sarah, would you like to read out the next question that we have in the chat?
Sure. So I think this question is directed more towards Megan. Just to clarify, the physician that oversees the tobacco cessation clinic is housed in oncology and not primary care. Is that correct?
So with the Duke program, we actually have 11 prescribers that work in lots of different settings. So we are not we're not really centralized as one clinic. Our providers are embedded in many clinics across the Duke Health Network. So I'm the only behavioral health provider with the program, but we do have 10 APPs and 1 physician who are part of the program.
So the next question, and maybe GCGA01 can come off mute or expand a little bit more on what they're trying to ask. But the question that's posed is to expand on the vaping a little more, young adults and vaping. So I don't know if anybody wants to jump in just to expand on vaping.
I guess I'm not quite understanding the question.
I don't know, GCGA01, are you able to come off mute and maybe pose your question or provide some clarity in your question?
Yes, thank you. Hi, my name is Gail. I'm with Atrium. And when we get young adults who vape, I'm talking out of college or people that are away from home and starting their careers, moving around the country, they just absolutely seem hopeless in a different way than our cigarette smokers are. They consume so much nicotine with that vape pen that never leaves their hand. I mean, this is, I see it out and about in Charlotte and well, everywhere. But I think looking at how do you help these people, it seems it's so different than cigarette smoking to me as I talk to these patients. And also, how do you match up the dosing for nicotine replacement therapies when they're constantly using? Where do you find that medium for meeting that dose with use? Like cigarettes come in a dosed pack. It's 20 cigarettes, we know what's there. Vaping is just the Wild West to me. It's a bottomless sea of addiction. And they just seem so desperate to be free of that. That it strikes me when I talk to these folks. I've got a 32-year-old who's across the ocean from his family or across it just seems like it's just so different. Even I understand with teenagers and you see young adults, but the folks that have been doing it since like college or now they're out and they're on their own and they're adults, they just seem, when they're ready to quit, they just seem so desperate, more like a drug addiction than the nicotine that I've seen with smoking. Does that make sense at all?
Yeah.
Yes.
So I'll speak for myself and our program, and I'll preface this by saying that I am not a physician. This is not medical advice, but a lot of times the pharmacotherapy is going to be different and need to be adjusted for those patients. So nicotine replacement might not be the best choice or the preference in that case for someone who's vaping for all the reasons that you mentioned. Something like varenicline may be a better option for someone who's vaping. But again, the behavioral counseling is going to be a big part of it, as always.
Thank you very much. It's obvious that there has to be that behavioral component. I just think they feel so defeated, desperate. That's the only word I can. It's desperate. They're desperate.
And that's important. Like even when you refer someone to the Quitline or to the texting program, This Is Quitting. You know, it's really important for that individual to get a prescription from their physician to help them with their quitting process, like the varenicline, so that they can monitor that better. We don't provide that through the Quitline. We do focus more on the behavioral part of it, but we dose them like we would a tobacco user. But the highest dose that you can get from the Quitline is the 21 milligram patch with the 4 milligram gum or lozenge, and they normally start people with that. And if they need less, you know, if they become sick or whatever, then they will work with their coach to reduce it. But that's, I think that's, you know, if they're that dependent and they have access to a face-to-face program, I would definitely recommend that.
Thank you. Sarah?
Thank you. Thank you for coming off mute to clarify the question. Locked my spot. Give me 1 second. Oh, here we are. Do you have something for those at increased risk of joining smoking? I guess for somebody who is about to, those that are at risk of potentially start smoking, do you have things for them?
Could you ask that again, Sarah?
So the question that's posed is, do you have something for those at an increased risk of joining smoking? So just the individuals that are at risk.
The more prevention type services?
Yep.
Yeah, we actually provide, you know, we have a resource if people would like to go to our website, which is, let's see, North Carolina. Well, if they, dude, I don't even know the name of it. It's the North Carolina Tobacco Prevention and Control.org. But if we have a lot of, and they can just Google North Carolina Tobacco Prevention and Control Branch, they will get to our site. But we have a lot of resources for education that can be provided in schools, such as oh gosh, I know that there's some people from actually I can actually show you. I think I might do that even more.
And while Joyce is looking up that piece, you know, I just wanted to add in that ties in really nicely to the question that followed up. So it looks, we have a lot of questions in that regard, in regards to what is the best way for persons to quit smoking in the first place. So seeing that as a theme in some of the questions in the chat.
Well, you know, as I mentioned in my in my presentation, most people try to quit smoking a lot of times before they're successful. The best way for people to be successful is to start with the most comprehensive program that's available to you. So a lot of those unsuccessful attempts, I said 7 or more in my presentation, a lot of those are cold turkey on your own attempts. And those have a very low chance of being successful, about 5%. If that. So the best thing to do in the beginning is just go straight to the most effective programs. Go to Quitline, go to your doctor, get the support that you need, both medication and behavioral support. That's going to give you the best chance of being successful.
Thank you, Megan. To follow up with that, we have another question in the chat, and being mindful that we have about 5 minutes left. I'm so thankful for the amazing questions that we have in the great discussion. The attendee would like to know this year, thank you so much for the insightful presentation regarding smoking cessation. Can I ask, what do you think is the best way pharmacists can promote these smoking cessation programs, especially to the curious youth exposed and inspired by social media? And I see you have some great information up, Joyce.
Oh, yay, Sarah, thank you. So that was the website that I was at, and that shows there's a lot of resources for young people and for parents and for school teachers of what they can do to help prevent tobacco use for teenagers, as well as how to help them, and all kinds of cessation resources for them. And then the question that you had asked a while ago was what, Kirsten?
The best way for persons to quit smoking in the first place.
Oh, it's as what Megan and I both have been saying over and over again. The best way to quit is to use an evidence-based program. You know, that is either, you know, through the Quitline, an evidence-based Quitline, which ours is, go through a program such as Duke or UNC, which is evidence-based, where they use all of these programs utilize behavioral interventions as well as medication. And so that is the gold star, you know, having medication plus behavioral interventions, either through group, individual, or the Quitline or phone counseling.
Fantastic. Well, we have 2 minutes left. Are there any additional burning questions that we would like to have addressed by our panelists? In our last few moments, Dr. Bell, Joyce, and Megan, if you could share, and as well as Sarah, if you could share a few closing words and thoughts in regards to the webinar, the training, as well as ways that we can move the needle forward in conducting this work in our respective spaces.
Well, what I can say is that for individuals who are trying to quit, don't stop trying. Just keep making that quit attempt, because eventually you will be able to stop. So everybody can quit. Sometimes it's harder for others than some, but you are able, using a evidence-based program. And for providers, you know, to not refer someone who is a tobacco user is almost malpractice, because as Megan said, 2/3 of the people that smoke will die. And just even your advice can cause 10% of people who walk in your office to be able to quit. So it's really important to add that to your, just even your your vital signs, asking people about their use, and then advising them about quitting.
Just to add to what Joyce said very quickly, share what you learned here. Share with your colleagues and your friends and anybody that you know who uses tobacco or comes into contact with those who do. Let them know this information.
Thank you. Dr. Bell and Sarah?
Yeah, I was just going to say, tobacco cessation has been one of the great public health initiatives of the last 100 years. And so but despite that, there's still a lot of people that smoke. And so I hope we continue to press forward with that. I also was impressed by the number of questions we got about vaping. I just recently watched the Netflix series Big Vape, and if you haven't seen that, please take time to watch that, and it will really drive home to you how vaping, the nicotine delivery and vaping is so highly addictive, and just the challenges that will now present to us as public health and clinical professionals. So but keep up the good work out there.
Thank you, Dr. Bell.
Yeah, and I was just kind of second what everyone has said. Big tobacco has a lot of money and resources, but I think our passion can outweigh those resources to combat their efforts. So I appreciate you all being on this call, and we can help together hopefully reduce the use of tobacco use.
Fantastic. It has been truly my honor and pleasure to serve as the moderator today for this engaging training. We will be following up with everyone via email in regards to ways to obtain your continuing education credit, as well as an evaluation survey. If you have any questions or would like to engage in some additional ideas that may have been generated from this training, please feel free to reach out to any of us that are serving on the panel. Also, we will be making sure that everyone receives a copy of the recording. So when the recording is available, we will make sure that we email it out to everyone. Thank you again for your time and your commitment to decreasing tobacco use across all of our respective communities. Wishing you a wonderful day. Thank you. Bye, everyone.